President.
Democratic Leader.
Madam President, a few minutes ago, for the second time this year, Senate Republicans began the process to pass legislation eviscerating Medicaid, abandoning our kids, failing our veterans, and squandering our future, all for the sake of tax cuts for the ultra-rich. This is the Republican agenda. Billionaires win, American families lose. Billionaires win, American families lose in the Republican plan. And Republicans have failed to be honest with the country about the true nature of their plans. They have tried to hide their Medicaid cuts. They have tried to hide their billionaire tax giveaways with budgetary gimmicks and distractions. They're tying themselves in knots. They don't want the American people to know what their agenda is. Well, if Republicans won't be straight with the American people about their agenda, Senate Democrats are glad to do it for them. Tonight, my colleagues and I will begin to put the Republican agenda on trial before the court of public opinion here on the floor of the Senate. It's going to be a long few days for Senate Republicans. Democrats will expose the dark corners of the Republican plan. We will explain the devastating consequence, highlight the many injustices that Republicans will inflict on people's health care, on their financial security, on their children's future, and on the very future of the American dream itself. We begin tonight with a topic close to home for all of us, Medicaid. It's my honor to join my fellow Democrats to lay the case before the American people for how Republicans plan to destroy Medicaid as we know it and harm millions and millions and millions of Americans. We will share the stories of people back home. We will illustrate the full scale of the destruction these cuts would do. And we will make it clear to the American people, while Republicans work like hell to eliminate Medicaid, to cut taxes for the rich, Democrats are fighting to protect the health care the American people deserve and need. And Medicare will be the first of 6 different themes that we'll focus on here on the floor. Tomorrow, we will be focused likewise as we debate this bill on Republicans' morally bankrupt tax breaks for billionaires, on Donald Trump's dumb and costly tariffs, on the need to stand up for our veterans and our national security, on the unprecedented corruption Donald Trump has unleashed in our government, and finally, on the existential fight to protect Social Security from the chainsaw of Elon Musk. These are the themes we will cover today and tomorrow. This is the fight the American people need to see, because people's lives and livelihoods are at stake. The health care that protects our kids is in danger. Our children, their health care is in danger. The benefits that keep our seniors whole are at risk. Senior citizens in their golden era could have Medicaid, the rug pulled out from under them, leaving them in dire straits. The investments that unlock America's future now stand on the edge of a knife. Why? Why? Why are Republicans doing this? Why are they being so cruel, so callous, so thoughtless? Why are those in the billionaire bubble who seem to run Donald Trump and Elon Musk? Why are they doing this? Very simple. They're trying to give the ultra-rich another tax break. The Republicans are enthralled with these very wealthy, very greedy people, and all they want is a tax break. And when Donald Trump became president, they got control of the Republican Party, and Elon Musk and Donald Trump are in the billionaire bubble. And when Democrats expose all these cuts to health care and veterans aid and benefits for the American people to see, the American people will think it's sickening. So tonight, let us begin with Medicaid. 70 million people rely on Medicaid in one way or another to provide medical care, and tens of millions more are their families and friends. That includes not just seniors, who are the 70 million, but also newborns, parents, Americans with disabilities, rural communities that have access perhaps to a single hospital or clinic if they're fortunate. Medicaid makes all these things possible. I want to focus on a truly sobering experience I had earlier this week, visiting 2 nursing homes in New York: Silver Lake Specialized Care and Rehab Center on Staten Island, and Carillon Nursing Home and Rehab on Long Island. These institutions alone, there's just 2 of them, serve over 600 residents together and employ 600 people. They're the lifeline to a local community. They help seniors with dementia, with post-surgical rehab, physical disability, and so much more. It was my visit to these communities was clouded by a shadow of fear and anger. I talked to senior citizens who knew if Medicaid was cut, they'd lose their health care. In fact, the owner of Silver Lake, one of the most esteemed health care facilities on Staten Island, told me if the cut were even half what the Republicans are proposing, his home would close. Hundreds of senior citizens would have no health care. 300 people would lose their job. They were frightened. They were scared. They were angry. There's no question about it. Even if Republicans pass a fraction of the cuts they're pushing, it would devastate these communities. We had the heads of major hospitals, many of them not the same party as mine, there, telling us what would happen if these devastating cuts to Medicaid went through. On Staten Island, we estimated 18,000 people would lose their jobs. Tens of thousands would no longer get health care. It would cause a recession on Staten Island like that. Seniors at the centers, new seniors who were getting out of hospitals or have a new illness that they were just encountering, would be turned away. There'd be no funding. There'd be no beds. There'd be no place for them to go. And most of the residents, it's not just the residents at these nursing homes, it's their children who now can breathe easy that their parents who helped raise them and worked so hard through the years to provide for them, their children now, Staten Island's a middle-class community, so is Long Island, the place I visited, the 2 places I visited. But their kids would not be able to care for most of them. Most of them need more health care than just going back to their kid's home. It's not enough, not adequate health care for so many of them. And others said their children had no extra room for them. What are even the kids going to do? In both Staten Island and Long Island, these are middle-class communities. They're going to be devastated by these cuts. Some of the residents said their children might be able to take care of them, but the burden would be immense. These families don't have the financial means to take care of their parents in their advanced age. They don't have space at home. They don't have the medical know-how to meet the needs like a nursing home does. And any of you, the millions of Americans who have a parent who struggled with dementia or physical disabilities, those people, we know that our parents need the help of medical professionals to care for them properly, and that's why Medicaid is so vital, so important, such a lifeline to tens of millions of families across America. The Republican Medicaid cuts would be a gut punch to these families. It was the same story on Long Island. Senior citizens scared, nervous, angry about what these budget cuts would do to them that the Republicans are proposing, that Trump and Musk are proposing. Workers worried they might lose their jobs. They work so hard in these facilities because they care about the patients they're caring for. Told, nope, no more funding. For no reason, they're doing a great job. Same on Long Island. as in Staten Island, and the same across all of America in poor communities, which of course depend on Medicaid. So many people, Medicaid is their only lifeline to health care, to middle-class communities, even well-to-do communities. All of them nervous, scared, angry, furious at what these cuts would do to them. Why, people ask, why are they doing this? Why are they being so mean? Why are they being so cruel? Why are they being so callous? And we have to answer, for one reason. They want to give billionaires a tax cut. And they want to take the money away from working families, take needs of things that working families need, take them away, and give them so there's more tax cuts for the billionaires. It angers me. It's infuriating that something so wrong, so callous, so detrimental to America could be right here on the Senate floor with the support of so many Republican senators. And I say to the Republican senators, listen to your constituents. Listen to your constituents. They don't want this. You know that. You're going to get up on the floor and make a speech that says you're cutting Medicaid because you want to give tax breaks to billionaires? That's what you're doing. Get up and have the courage to say it. Get up and have the courage to say it. The senior senators I visited were represented, actually, by Republican members of Congress in both Staten Island and Long Island. There, I told every patient, every doctor, every nurse, every employee who works in these institutions to call their Congress member and tell them that their jobs are at risk. If they're a resident, to tell them their health care is at risk. If they're a child of a parent in one of these nursing homes, call. I told them to make it clear to their congressmen that the Republican congressmen and senators have the power in their hands to stop these cuts because there are narrow margins in both the Senate and the House. A handful of senators, a handful of congressmen, if they had the courage to do the right thing, and most of them, or some of them at least, know that it is the right thing, even though they're afraid to vote yes. They're afraid to vote no and stop this. But they should have the courage to do it. So I told them, I told everyone I encountered in these two nursing homes and many other places in New York. I went to a hospital in the Bronx, one of the biggest hospitals. It serves 1.3 billion people, 1.3 million people in the Bronx. It's the only cancer care treatment for all those 1.3 million. The leaders of that hospital told me the hospital would probably close if there were a 20% cut to Medicaid, and the Republicans are proposing a deeper cut than that in this budget bill. Close. The only hospital, one of the biggest employers. It employs 18,000 people itself. And this story could be repeated. The Bronx is a poorer community. Staten Island, Long Island, more middle-class communities, but every one of them will be affected terribly by these cuts. So I told them to call. I tell everyone, we have to stop this. Public sentiment is everything. Every American in a similar position to those I spoke to should do the same. Call your congressman, call your senator. Tell them you don't want Medicaid to be slashed. Tell them you don't want nutrition assistance to be eliminated. Tell them you don't want our seniors to be abandoned. Tell them you don't want to see these cuts, these cruel, heartless cuts, just so the wealthiest Americans can get another break they don't need. That's what the next few days are about, fighting these awful cuts done to help the wealthiest Americans get a tax break. That is the fight Democrats will have here on the Senate floor. That is the fight we will have tonight. That is the fight we will have tomorrow and beyond. Democrats are fighting every day in every way against these attacks, against American families, against this plan which says billionaires win families lose. Democrats stand united. We are unified in fighting this awful bill. We will fight the Republican anti-family agenda. We will shine a light on these terrible cuts that Republicans are trying to pass, and the American people will be horrified at what they see. I yield the floor.
Madam President.
Senator from Oregon.
Families lose and billionaires win. That is the Republican plan. A plan slashes $1.5 to $2 trillion from programs that families depend on. And why? To fund tax cuts for the very richest Americans. But that's not all the bad news, because there's additional tax cuts for the best and richest in the country, the richest Americans, and those are unpaid for, and that means debt. How much more debt does this bill create? Well, the current estimate, and the estimates keep going up, $5.3 trillion unpaid for tax cuts over the next 10 years. 5.3 trillion, trillion with a T, over the next 10 years. But that's not all. Their plan provides for 37 trillion, at least 37 trillion, in additional debt over the next 30 years. This is a phenomenal, phenomenal number. And third, they say, we will tell the American people it adds no new debt. Passing this bill adds no new debt. Well, that's quite a set of plans. Slash programs for regular Americans, enrich the richest Americans, run up an additional $37 trillion in debt, and then lie to the American people and say it doesn't cost a thing. It's become clear over the last 2 days about how Republicans are going to justify this. They say they're going to use Section 312, Section 312 of the law. And Section 312, they say, says that the cost of a program or the impact of a revenue cut through a tax giveaway to the wealthy only costs what the budget chair says it costs. Just take the chair's word for it. This is the magic wand. It'll add $37 trillion to the debt, but if the budget chair says it doesn't, then you just pretend it doesn't. It's kind of like the situation where the king wears the magic robes. At least he thinks he's wearing magic robes, but he's actually walking down the street naked, because he doesn't have magic robes. And in this case, again, lying to the public about the cost. You know, in the real world, you have real math. In this special new world of the Republican plan, you have the magic math. Well, this was not the vision that was laid out back 51 years ago in 1974 when the Senate created, along with the House, the Budget and Impoundment Control Act. You know, that act had 3 pillars. The first pillar was that in a 10-year period, you have to decrease the deficit with the provisions that are in the bill. And then in every year after, in every category, it either has to be deficit neutral or reduce the deficit according to the provisions that are in the bill. And then it said we're going to use honest numbers. Well, before there'd been, a lot of smoke and mirrors. There'd been a lot of gimmicks. And people on both sides said, no, we don't want to do that. Democrats and Republicans said, let's use honest numbers. Let's create a congressional budget office to give us impartial numbers so we can be honest among ourselves, have a real debate about any given policy provision or any particular revenue provision, and we can be honest with the American people. Because otherwise we'll just keep running up more and more deficits while pretending we are not. Now, my Republican colleagues initially said, you know what, we'll just put a clause into the budget resolution. It's called a scoring rule. And that scoring rule will simply say that we're going to say this costs nothing, that there's no additional debt. Well, a scoring rule has been used in the past. Okay, it's been used in multiple years, but it was used to resolve little anomalies in tricky little twists and changes in revenue bills or in policies programs. It was always narrow. It always was honest about what it was trying to solve and explainable to the public. It was always consistent with the law. And it was always involving modest sums, modest by standards of the national budget. Certainly now, this scoring rule that had been proposed by the Republicans, it was not bipartisan, it was not narrow, it was not improving the budgeting, and in fact lying about the budgeting. It was not consistent with the law, and it was massive, $37 trillion. So my colleagues across the aisle, when we pointed this out, they said, yeah, we better not do that. That's just wrong. Okay, thank you. Thank you for deciding not to put in a scoring rule that was completely wrong and designed to destroy the budget process. But now, my colleagues across the aisle have said, we'll use a different provision called Section 312. We won't use the scoring rule. Instead, we're going to go a different direction that says simply that the cost is what the chair of the Budget Committee says it is. Now, I want to turn back the clock a little bit. I want to turn back the clock and point out that there were core principles in that 1974 bill, and they were driven by growing bipartisan concern about deficits and debt. In the 1958 to 1968 decade, the average deficit was about $5 billion per year. That doesn't sound much by now, our standards, when we're looking at $2 trillion per year, but it was a lot compared to the past. And folks said, you know what? That $5 billion per year over that 10 years exploded to an average of $20 billion a year in 1971 through 1973. Oh my goodness, it quadrupled. We've got to get a handle on these deficits. We don't want to run up this debt, this fourfold increase in annual deficits adding to the debt. So Democrats and Republicans came together and they passed the 1974 Budget and Impoundment Control Act. It created a superhighway for this special effort to reduce deficits. A superhighway, a super filibuster-free highway. Now, you all may remember Robert Byrd of West Virginia, and Robert Byrd was always the fiercest defender of the filibuster. But he, along with 99 other senators, said we will create one exception, and that exception will be to reduce the deficit. And it had these three pillars, which I'll mention again. It has to reduce the deficit. The provisions of the bill have to reduce the deficit over the first 10 years. They have to be deficit neutral in every category in each year after the first 10 years. And we have to use honest numbers. And to have those honest numbers, we will create the Congressional Budget Office, impartial body. We will no longer use smoke and mirrors, pretend that things don't cost money when they do cost money. But then what happened? Well, I'll tell you, for 22 years, it worked pretty well. Then along comes Gingrich Revolution, 1994 election. Now we have the 1995 through 1997 biennium. And some things happened then that, well, one maybe couldn't have foreseen, maybe we could have. There was an effort to do a balanced budget amendment. It fell one vote short here in the Senate chamber. It needed 67 votes. It only got 66. And then there was the we'll do a line item veto, and that was passed. But that gave the power to the president to strike down any line, and the Supreme Court said, no, you can't do that. You can't delegate the power of the purse. Power of purse belongs with Congress. So that fell. And then the Republican caucus in charge said, we are going to instead do a big tax bill giving enormous benefits to the richest Americans. And then they said, but you know, the problem with that is the Democrats won't work with us. They won't give us 60 votes to do that. Oh, I know, they said, we'll do a nuclear option. We will repurpose the deficit decreasing bill from 1974 and say that it can be used in order to actually increase deficits with tax cuts. And they succeeded. They had the votes, they repurposed the bill, they blew up the first pillar of those three pillars. That first pillar was the reconciliation process. This special process created in 1974 can only be used to reduce deficits in the first 10 years. They blew it up and said, okay, nuclear option, we've reinterpreted the rule, it can be used to increase deficits. Well, that was a huge, huge damage to the goal of reducing deficits, and deficits have gone up ever since. And when that happened, there was a big protest on the floor. The first Budget Committee chair who passed a reconciliation bill consistent with decreasing deficits was South Carolina Senator Fritz Hollings. And he said, the whole idea of reconciliation, and I am giving you firsthand history, it is honest as the day is long, was to, by gosh, cut back on the deficit. That's what it was for. So the Republicans blew up that pillar, all designed to reduce the deficits, and instead repurposed it for increasing the deficits. Pillar number one drops. But at the same time, the second pillar, that no increase in deficits could occur after 10 years, was sustained by the chair sitting and presiding over the Senate. And that was Senator Daschle. And Senator Daschle said, well, actually, he asked the question. He was asking the question of the Republican chair. He said, if this reconciliation bill does not find a way to end or offset its tax cuts in the years beyond 2002, that is beyond 10 years, would the bill violate the Byrd Rule? And the presiding officer responded, yes, it would. So Pillar 2, no deficits in any category beyond 10 years, was preserved until now. Now, 1996, and here we are, 29 years later, and now there is a goal to destroy the second and third pillars of the 1974 bill. I must say this is extremely extraordinary and disturbing that my Republican colleagues who run on fiscal responsibility destroyed the first pillar of the special system to reduce deficits in 1996, and tonight they are proposing to destroy the second and third pillars. In that second pillar, no deficits beyond year 10. Every category, every year has to be deficit neutral or reduce the deficit. We can compare that to the law that has just been put forward, or the guidance that has just been put forward. We can look at year 11, the instructions that go in every category, year 12, 13, year 20, year 100. That goes on forever into the future. And the Republican bill guidance fails the Byrd test. Now, the Byrd test really gets applied in a second stage of the reconciliation process. We're in the budget resolution that sends instructions to committees. Those committees will send back specific revenue provisions, increase this revenue here, reduce it there, proceed to add this policy program, reduce this policy program. When it comes back, every category, that is every title of the reconciliation bill, in every single year, by the Byrd rule has to be deficit neutral or decrease the deficit. So we will have that debate. But we will have that debate when the reconciliation bill comes back from committee to this floor. Because my Republican colleagues decided to postpone that debate by taking the scoring rule out of their proposed budget resolution and said, we'll kick it down the road to the next stage. And certainly we will be here fiercely defending the deficit-reducing vision of Pillars 2 and 3. Pillar 2, no deficit in any category, any title of the bill beyond year 10. And Pillar 3, use honest numbers from the Congressional Budget Office. That pillar has survived since 1974. We even put that pillar into law specifically in 1985 in a bipartisan way. We wanted to emphasize how important that was. Just think about how much more important this process of deficit reduction, special rule of the reconciliation bill is today than it was back in 1974. In 1974, the debt to GDP ratio, 23%. Tonight, in 2025, it's 100%, equal to the entire gross domestic product of the United States. In 1974, the annual deficit was about $6 billion. Today, it's $2 trillion. 1974, total debt, $475 billion. Today, it's $37 trillion. Now, consider this. All of the debt run up over the last 249 years since the Declaration of Independence right now is just a little bit less than $37 trillion. In this single bill, Republicans are saying we will add $37 trillion more, at least that much. When the numbers really come out, we expect it to be higher. $37 trillion more to the debt. That's a much bigger burden on the future. And what do the economists say about that bigger burden? They say it will increase the interest rates that families have to pay on their mortgage and on their car loan. It says it will decrease the capital available to private industry and slow down our economy. This magic math goes by the name of current policy baseline. It sounds very academic, but it is essentially the big lie. Consider this. You sign a contract to rent a home for a year, and renting that home costs $2,000 per month, so you know you're going to have to pay $24,000 over the year. And at the end of the year, you say, you know what? I'm going to renew that agreement to rent this apartment. And your spouse says, you know what? That's going to cost us another $24,000 in rent. And you say, no, I'm using the Republican magic math. It won't cost a single dime, because we'll just pretend that a year ago we had planned to rent the apartment for a second year. And therefore, it's no more than we thought we would pay a year ago, except a year ago you said you're only going to rent the house for a year. In other words, it's a big lie. It is the very smoke and mirrors, the very gimmicks that Democrats and Republicans came together and stopped back in 1974. 51 years ago, we said this game of lying to the public has to end. But tonight, my Republican colleagues are saying that game will continue if they have their way. Well, we say they must not have their way. We are going to stand up and say no to families lose and billionaires win. We are going to say no to magic math that lies to the American people about the cost of their bill, driven by massive tax cuts to the richest Americans. It's a simple request: honesty and integrity. We should not be engaging in a big lie, and Democrats will have no part of it. We are going to be honest about what every provision of the reconciliation bill costs. We are going to be determined to make sure that the Byrd rule stands. Thank you, Madam President.
Madam President.
Democratic Whip.
Madam President, this has been an amazing week in the United States Senate, and I've served here for over 25 years. Just 2 days ago, our colleague Cory Booker from the state of New Jersey ended a filibuster on the floor after 25 hours, broke the record, longest speech in the history of the Senate, and an impassioned speech it was. I was happy to be here for a major part of it. There was a big celebration on our side of the aisle, and the galleries were filled in a way I've never seen before, cheering Cory Booker for his achievement. It's a moment when all of us who serve in the Senate, lucky enough to serve in the Senate, will remember the rest of our lives. But I remember another moment that affected more people than this miraculous feat by Cory Booker. It was July 28th of 2017. It was 2:30 in the morning. I was seated at this desk, and a historic vote was about to take place. The vote was whether or not we would keep the Affordable Care Act, or Obamacare as it was known then, extending health insurance to millions of Americans, some of who never had it. At the time, President Trump was in office, and he and the majority of Republicans were determined to eliminate the Affordable Care Act, to eliminate the insurance that millions of American families depended on to protect their kids and themselves. It was as close as possible vote. In the end, at least 3 Republican senators voted to save the Affordable Care Act. But the one key vote, and the one I remember, was John McCain. John McCain, an extraordinary man, served this country in ways that we can hardly ask anyone else to serve. Prisoner of war for over 5 years during Vietnam, came battling back and elected to the U.S. Senate from Arizona. And he was a real maverick. You never knew where John was going to end up, but you always wanted to end up with him if you could, because it was always a spirited contest and he usually won it. And this vote was dragged out for a long period of time at 2:30 in the morning, for goodness sakes. And somebody said, John McCain is the last person to vote. But he's been called out off the Senate floor to go into a room behind and take a telephone call from Donald Trump. Donald Trump, president in his first term, was asking John McCain to cast the deciding vote to eliminate the Affordable Care Act, health insurance coverage for millions of Americans. Madam President, I sat here and I watched as John McCain came in from that phone call, and no one knew what he was going to do. Really, no one knew. John was the kind of person you could never quite be sure. And he walked in the well near the table where the Republicans gathered for votes, and he stood there, and he barely raised his left arm because it was broken while he was a prisoner of war, just enough to get his thumb up and go, no. No. That was it. John McCain, with that no vote, saved the Affordable Care Act, and millions of Americans' health insurance was protected. This was during Trump's first administration, and he had other priorities, and they certainly didn't include Obamacare. He wanted to eliminate it. But John McCain's courage came through that night. He broke with his party because he knew what was at stake. He knew that for millions of Americans, there was no alternative when it came to health insurance. It was the Affordable Care Act or nothing. And he had the guts to vote no. Oh, he was pilloried and criticized by the Republican faithful from one end of the country to the other. But those of us who believe he did the right thing will never forget that moment of courage. In a strange way, today, Thursday, April 3rd, 2025, we are returning to that moment in history. The Republicans under President Trump in his second term want to perpetuate his tax cut that he gave primarily to the wealthiest people in America and add to it at the expense of health care for America. When we talk about health care in America, one of the programs that is so critical is called Medicaid. In days gone by, Medicaid was a rarely used health insurance plan for the poorest and disabled people in America. But it's changed. It's become much different. And let me tell you why that's an interesting context for where we stand now. Many Americans from coast to coast follow the stock market today. The reaction of the stock market to the Trump tariff tax and the chaos that's been created since he announced we were going into a trade war with virtually every nation on earth. They watched carefully as the stock market reacted to it today. The Dow Jones average, which is supposed to be an indicator of the state of the economy, lost 4% of its value today. I don't know what that means for most people, but I know that most people watch it because it involves their own health, their own retirement plans, IRAs and 401ks and other plans that they have based on the value of stock. There has to be a sinking feeling, I'm sure there is in many households and families across America, to see so much of value that they've saved up for a lifetime disappear in one day, reacting to the Trump tariff tax and what it meant across the country. And here we come this evening, the same day as this Dow Jones plunge of 4%, to discuss what? Health care again under President Trump. And this time it's connected to retirement and savings and the future of a lot of families. Let me tell you a story about one. I'm going to try to mask the details because I don't want anyone to reflect on the actual person. But he's a friend of mine, and he's a professional in Illinois. Wonderful guy, community leader, and he had a beautiful family. Still does for that matter. But his wife developed Alzheimer's. This lovely woman reached the point where she had to be put into a care facility to take care of her day to day. Breaks my heart to even think about it, but it was a fact. He didn't see it coming. There's no way he could have. But for years now, she has survived physically, while mentally she has deteriorated to the point where she cannot communicate with him or others. It's an expensive undertaking, that type of care facility. He can afford it, but many people can't. So what do? What happens when your mother or grandmother, when someone you dearly love in your family reaches a point where they need this kind of care? Well, you do what you can, the best you can, with your own savings and your own resources. But ultimately, the major source of funding for people who are in these facilities is Medicaid. If you cut Medicaid reimbursement, it limits the opportunity for these people to get good professional care. People you love, people who've broken your hearts because of their illness, but you want to give them the very best in the parting years of their lives. So when you cut Medicaid, which is going to be proposed by this Republican budget resolution, it's at the expense of families' peace of mind and resources they've saved for their own future, their own retirement. That isn't the only one. In the state of Illinois, half of the children who are born in the state are paid for by the Medicaid system. What happens if you cut back on Medicaid reimbursement in those cases? It means less prenatal care. The likelihood, I'm sorry to say, that kids, some will be born with problems that could have been avoided, and more seriously, whether or not these children may even survive birth. That's what Medicaid is all about. We're talking about cutting health coverage for those in care facilities as well as those in hospitals who are giving birth. Why? Why would the Republicans even suggest that we cut this? Just like they did years ago when John McCain cast that deciding vote. Why, under a Trump presidency, do they go after health care first? Why is that their target? They believe that the vulnerable people who receive this kind of health care assistance won't be able to fight back. And they are desperate to raise more revenue. For what purpose? To give tax cuts to the wealthiest people in America. For goodness sakes. Elon Musk does not need a tax cut. He's a multi-billionaire, the wealthiest man in the world. Why in the world would we cut back on any kind of health care for Americans to give a man in that station in life a tax break? And that's what it's all about. But there's more to the story. I'm honored to represent Illinois. I love the whole state. It's where I was born. And I'm honored to represent the great city of Chicago. Oh, it's controversial. There's some people downstate Illinois say, oh, they go off and be their own state. We're tired of them. I'm not one of those people. I am proud of the fact that Chicago is part of our state. But my roots are in downstate Illinois. I'm born in East St. Louis, raising my family in Springfield. I have lived in and represented the smaller communities downstate and the rural areas. That's how I got to Congress in the first place, and that's how I stayed in the United States Senate. What are these cuts that the Republicans are proposing in Medicaid going to do to rural and downstate Illinois and other rural and downstate areas around the nation? The reality is very clear. Fewer resources to hospitals in sparsely populated areas mean that many of those hospitals will not survive. Today, more than half of those hospitals are hanging by a thread, operating in the red. And to cut Medicaid reimbursement to those hospitals is literally going to close their doors and turn out their lights. How important is a little hospital in a community downstate? It is the economic engine. It is the hub of life for the economy of that area. Take away that hospital and it not only endangers the people living around it, it also means a lot of jobs are lost too. And businesses that those people frequent often are going to be threatened as well. So why would we cut Medicaid reimbursement and close these downstate hospitals to give a tax break to the wealthiest people in America? It makes no sense. Where are our priorities? Where is our humanity to even consider that? I don't understand on the other side of the aisle how Republican senators, many of whom represent small town America too, and really care in their hearts about it, can stand by and let this happen. The net result of this is going to be the quality of life threatened by the people who live in those areas. I want to tell you a story about a community that I visited 2 weeks ago, two communities. One was Taylorville, Illinois. And I asked the hospital administrator in Taylorville, which is about 30 miles from Springfield, to come and invite other hospital administrators from the area and tell me what the Medicaid cuts proposed by the Republicans to give tax breaks to the wealthy will mean to these hospitals. To a person, they said the same thing. They may survive, but it's a big question. And what difference will it make? Well, in some of these hospitals, it means that instead of 30 minutes drive to the hospital to deliver the baby, it'll be an hour and 30 minutes. I can still remember our first babies in my family. The thought of being in a car for an hour and a half with my wife in labor would scare me to death. But that would be the reality for many people, and alternatives are just not available. Why in the world would we reach a point where we would cut that kind of coverage, that kind of protection, that peace of mind to give tax breaks to the wealthiest people? It makes no sense. Medicaid and the CHIP program cover nearly 40 million children, half of all the kids in America. Medicaid provides health coverage for 60% of seniors in nursing homes, the ones I mentioned earlier. And it's the largest funder of addiction and mental health treatment. I will tell you, I know the cases pretty well of people who are desperate for addiction treatment. They realize that they are addicted, they realize they have a problem, and they're anxious to get started in cleaning their lives up. Medicaid is the source of funding for that kind of counseling. And to cut back on that is to really sentence these people to a lifetime of fear and sadly cost many of their lives. In Illinois, 3.4 million people are enrolled in Medicaid, 1.5 million children. Under Republican plans to slash Medicaid, 775,000 adults in Illinois who gained health insurance thanks to the Affordable Care Act, the same one that John McCain saved in the first Trump presidency, would lose their coverage almost overnight. How would you like to be in a situation where you don't have health insurance at a critical moment? I know. I was there. I was a student at Georgetown Law School, got married in my second year, and God sent us a beautiful little baby girl right away. We were so happy. And then a few weeks after she was born, we learned she had a serious congenital heart defect. I was a law student. I didn't have much income, and I had no health insurance. And so my wife and I took our little baby girl over to Children's Hospital here in Washington, D.C. We sat in the charity ward, and we waited until our name was called. And we saw a doctor who I prayed to God would be able to save my baby's life. I never felt more helpless in my life than I did at that moment. To have this little girl come into this world, and her father couldn't provide health insurance. Luckily, she survived. Great people did great favors for our family that I'll never forget. And I've never forgotten that whenever there's a health crisis or a health issue that's debated on this floor. All of us want good health insurance. And to cut the programs for no reason other than to give tax breaks to the wealthiest people makes no sense whatsoever. It is not sensible, it's not thoughtful, it is not humane. That is what this debate is all about. Are we going to protect health insurance for Americans so that they have some peace of mind that they have access to good care? Or are we going to cut them off, tell them they're on their own, whether it's mental health counseling, addiction counseling, the birth of a child, or basic health care? That's what's at stake here. That is what is at stake. And so I would plead with my colleagues, and I know that it's unlikely. I've seen the votes. I know the discipline, party discipline. I've seen it on my side of the aisle. I'm sure it's on the other side of the aisle. But I'm praying to God there's going to be one or two John McCains who are going to step forward and lift their hand enough to vote and save health insurance for Americans across the board. I know that some people will be unhappy. In fact, some may threaten to defeat you politically because of it. But I'm sure that after John voted no and saved the Affordable Care Act, despite President Trump's telephone call in his first term, John had the satisfaction of knowing that for millions of Americans, he was the man and his vote was the vote that made the difference. It might have denied some tax breaks for some wealthy people, but for others it gave them peace of mind. John was just enough of a maverick to be willing and able to do it. He will be fondly remembered in history as a result. So, Madam President, I'm going to close by saying that this is an issue that's near and dear to my heart, and I think to a lot of other people too. They've gone through experiences much like my own, and I know they realize that we have few moments of opportunity and service in the Senate to really make a difference in the lives of American families, to give hope to people who have given up because of a mother who's in a nursing home or because of a child with an illness. I've received letters. Sophia, a single mom from Palatine, Illinois. 17 years of her age, she gave birth to a baby boy. Her son was born with many medical complications. He had to undergo 2 surgeries in his first day of life. Can you imagine? By the age 4, he had undergone 8 separate surgical procedures to address ongoing medical challenges. How did Sophia Palatine afford the life-saving care for her son? He was covered by Medicaid. She wrote to my office, she said, I don't want Medicaid. My son needs Medicaid. I could not be able to afford the thousands of dollars of medical care to keep him alive without it. Amber from Springfield told my office in no uncertain terms, you cut Medicaid and you endanger my sick child's life. That's what it is. It's a life and death issue. It's not for how many dollars you're going to have left over when you file your taxes. It's a life and death issue that we're debating. I want to thank those who have spoken this evening already, Senator Schumer, Senator Merkley, for their leadership on this issue. And I just plead with my colleagues on the other side of the aisle, please, there's got to be someone over there who will step up and have a McCain moment that will save health care for millions of Americans. I'm praying that it happens. I yield the floor.
Madam President.
Senator from Wisconsin.
Madam President, I rise today on behalf of the 1.2 million Wisconsinites who rely on Medicaid, or as we call it in Wisconsin, Badger Care, for their health insurance. And I rise today in their defense because their health care is under attack. And I really want to focus right now, kind of taking off where Senator Durbin left off, talking about our children. our babies. 1 in 3 children in Wisconsin rely on Medicaid for their health insurance. That's 1 in 3 children in Wisconsin's urban, suburban, and rural counties who need Medicaid just to see a doctor or to get regular checkups or to get vaccines and to stay healthy. I've traveled across Wisconsin meeting with constituents who are terrified about what these cuts will mean for their families, their finances, and their health. And I'd like to share a few of those stories with you this evening. I think about people like Megan from Wisconsin, a single mother of 2 young children who relies on Medicaid so that her kids can get regular checkups and see the dentist. She reached out to me to share that without Medicaid, her entire paycheck would go to just keeping her children healthy, with nothing left over to pay for rent or keep food on the table. I heard from Shelley in Lake Holcomb, Wisconsin, who reached out to me about her 17-year-old daughter, Chloe. Chloe was diagnosed with leukemia last October. Chloe receives chemotherapy 5 days a week, and her parents drive her almost an hour each way to Eau Claire, Wisconsin, so that she can get the treatments that she needs. Without Medicaid, the cost of Chloe's treatment would force Shelley and parents like her to make an impossible choice between financial ruin or not getting the care that they need for their children. I've also heard from dozens of Wisconsin families whose children live with disabilities. They are terrified of what financial cuts will mean for their kids' future and their family's finances. Jennifer in Wauwatosa wrote to my office about her son, Will. Will is a 15-year-old sophomore at Wauwatosa West, who she described as vibrant and loving. Will also has Down syndrome, which, among other medical care, has meant that he's needed a total of 11 ear tube surgeries just so that he can hear. Jennifer wrote me that the math on those costs to their family is pretty simple. 11 surgeries, which cost $10,000 each, without insurance, would cost her family $110,000. She said without Medicaid, she and her husband would struggle to give their children the lives they deserve, including paying for their other sons' college tuition. She wrote, if Medicaid is cut, we will struggle financially. We will not be able to get Will the support he needs to be independent, to get a job and go to college. It could even mean one of us having to leave our full-time employment, which could hurt even more. Please don't cut Medicaid, she said. I also heard from Brooke in Thorpe, Wisconsin. She shared that because of Medicaid and the speech therapy for her 4-year-old son that he receives, she has, for the first time this year, heard his voice utter more than one syllable. Imagine that. She wrote, and I quote, "It marks the first time I have been called mom by him, and I have heard, 'I love you,' come from him 3 times, all occurring in the last 12 months. He receives speech therapy 5 days a week to learn how to express himself, to process emotions, and to regulate. This has changed his life, and these therapies are paid for by Medicaid. Don't allow people like me to only hear 'love you' a handful of times simply because of a budget cut." We can talk about the number of children who will be impacted by cuts to Medicaid, a total of over 30 million nationwide. While that number is staggering, it's important to remember that every single child who relies on Medicaid has a story, like Chloe's or Will's. And they have parents like Megan and Brooke who just want what's best for their children and are terrified about their future if Medicaid is taken away. If my colleagues on the Republican side want to go through with cuts, the ones laid out in the House's budget plan, it's these families Republicans must answer to. Donald Trump and congressional Republicans can explain why they are planning to rip away health care for children so that the top 1% can get richer. I, for one, would like them to answer for the chaos, for the fear, for the heartache they are causing families in my state. I yield.
Madam President.
Senator from New Hampshire.
Thank you, Madam President. And I want to thank my colleague from Wisconsin, Senator Baldwin, for such excellent, poignant, moving descriptions of the real cost of this budget plan that we are on the floor to consider tonight. I rise today to join my colleagues and the people of New Hampshire in standing up against the attempt by the Trump administration and some of my Republican colleagues to effectively end Medicaid as we know it and add $37 trillion over the next 30 years to our national debt, all in order to pay for more tax giveaways for corporate special interests and billionaires. Americans of every political stripe are alarmed because this bid to end Medicaid as we know it will lead to more families, more children, becoming sick and unable to get care, and because ending Medicaid as we know it will devastate our economy, weaken our workforce, and most of all, make our people less free. Medicaid is a pillar of America's healthcare system. Tens of millions of Americans, including working Americans, pregnant women, and millions of children depend on Medicaid every day for routine care, for treatment for chronic illnesses, for life-saving care from serious illnesses, for treatment for addiction, and for much more. No legislation has done more to allow more Americans to live longer and healthier lives than the bills that established Medicaid and Medicare and the efforts that followed to strengthen both of these landmark laws. So before we proceed, let's take a step back for a moment and remember that Congress created Medicaid for two simple reasons. Prior to Medicaid's creation, a great swath of our country, tens of millions of Americans, were forced to try and get by without health care. For many working people and their families, the kind of routine and preventive care that many today take for granted were luxuries. Serious illnesses were often left untreated, becoming virtual death sentences. We established and later expanded Medicaid because we understood that in a country as great as ours, we don't turn our backs on our neighbors. But we also created Medicaid because we know that it is in all of our economic interest to have more healthy people. When more people are healthy and able to work, they can get ahead and stay ahead, provide a better life for their family, join the workforce, and in so doing, make our economy stronger. There is, of course, much more work to do to make health care more affordable for all of our people. But Medicaid saves lives. Over the course of the program's history, Medicaid has allowed hundreds of millions of Americans who otherwise would be uninsured to live healthier lives and to build a future. But now the Trump administration and some of my Republican colleagues are poised to end Medicaid as we know it in order to pay for tax breaks for corporate special interests and billionaires. The Republican plan to eviscerate Medicaid would be devastating to our country. The Republican plan is, unsurprisingly, short on details. But they've put forward proposals that, if you do the math, means cutting a third of federal Medicaid funding, all to give billionaires and corporate special interests a tax break. Now let's look at what this decidedly unreasonable, outrageous, and dangerous plan would do. Cutting Medicaid by a third means living in a country where millions of children no longer have health care. A country where more of our friends and neighbors get sick and can't afford to see a doctor. Or a country where more of our friends and neighbors stay out of the workforce because they can't afford treatments for chronic conditions like lupus, making them too sick to work. A country where families who have children with disabilities can't find adequate coverage to provide the kind of complex care, both at home and in school, that these children need. One issue in particular I want to highlight is the way in which slashing Medicaid would weaken our fight against addiction. New Hampshire has been hit hard by the fentanyl crisis. These Medicaid cuts could kick hundreds of thousands of people struggling with addiction off of Medicaid, out of treatment, and off the road to recovery. This will, among other things, make law enforcement's job even harder, and it will make our children less safe. So let's be clear about what the Republican plan to slash Medicaid will do. It will make people less healthy. It will weaken our workforce and hurt our economy. The fight against fentanyl will only get tougher, and more people will die who otherwise could have lived. If the administration's plan to eviscerate Medicaid, the cuts only appear on the page as percentages and dollar signs, but their impact will be felt by real people. My office, as has Senator Baldwin's and Senator Kim's, Senator Durbin's, been deluged with letters and calls from constituents who are concerned about the administration's attack on Medicaid. I could tell you hundreds of stories, but instead I'll just give you three. There's Michelle from Manchester. She was diagnosed with a rare and frequently fatal form of cancer that upended her career and her life. To go through the long process of cancer treatment by paying out of pocket would be daunting, perhaps even prohibitive for most anyone. But Michelle was covered by Medicaid. She got the care that she needed. She got healthy. She was able to go back to work. She's now cancer-free because of her courage and strength, and because she was covered by Medicaid. Then there's Noah from Merrimack. Now, Noah's 20 years old and experiences disabilities and is blind. She's had to face challenges that few of us can imagine. But thanks in part to the support that she's received through Medicaid, she's been able to have many of the opportunities that all parents want for their kids and that all kids want for themselves. She has a part-time job at a nearby bank. She does charity work delivering flowers to seniors. She loves horseback riding and has competed as a Special Olympian. She accomplished all this thanks to her bravery, optimism, and generosity, but she may not have even gotten that chance without Medicaid. And then there's Sherry from Lebanon. Like other Granite Staters, she's had struggles with addiction, as well as some mental health challenges. But Sherry was eligible for Medicaid. She got treatment and went into recovery. She was able to go back to work. Today, Sherry is a perinatal peer support educator and coordinator for Dartmouth Health. She helps families every day. Because she got care when she needed it, she's now working to provide care for others, touching untold and unknown numbers of lives through her work. And she was my guest this year at the President's Joint Address to Congress. But none of her recovery, employment, and life-saving work would have been possible or happened without Medicaid. So if the administration intends to eviscerate Medicaid, if they intend to go through with their plan to cut Medicaid by a third to pay for a tax break for billionaires, then before they do, they should at least stop and explain, of these three people, Michelle, Noah, Sherry, who is the one that they want to kick off of Medicaid? How would any of us be better off if any of these three people are forced to go without health care? Most Americans are proud of our capacity to come together and ensure that our friends and neighbors can get health care and be able to work and raise families. But this administration evidently considers the provision of life-saving health care to Americans from all walks of life to be a problem. Now, beyond the huge price tag of this budget plan, a plan that explodes the deficit by $37 trillion more over 30 years. And let's be clear, the Republican budget writers are going to use accounting gimmicks to try to hide this cost. And let's be clear, too, that the $37 trillion in additional debt won't be used to improve health care. It's to pay for tax breaks for billionaires. But there is another cost to the president's attacks on Medicaid. Because as important as it is that we protect the health care provided by Medicare, and that's tremendously important, protecting Medicaid health care marks neither the beginning nor the end of what we need to do to improve health care in our country and make it more affordable. We need to confront real challenges in our country's health care system. Big Pharma keeps drug prices too high. We have the best doctors in the world, but too few people can afford to see them. Too many Americans live with chronic diseases. Labor and delivery centers across our country are more and more scarce, and rural hospitals are struggling. Americans need to summon our best ideas and our best efforts to meet these challenges, but we will not make progress so long as this administration continues to keep us trapped in old debates and tries to unravel bipartisan support for the progress that we have already made. Of course, it doesn't have to be this way. When I was governor of New Hampshire, we managed to expand Medicaid and balance the budget at the same time, and we did both on a bipartisan basis. We did it with the support of many business leaders and law enforcement leaders who didn't always vote the same way come November, but they did agree that we're all better off when people are healthy. President Trump and congressional Republicans are presenting us with a false choice. We don't have to choose between keeping the status quo on the one hand and blowing up our health care system on the other. We don't have to buy the falsehood that somehow we have to close rural hospitals and throw seniors out of our nursing homes to improve our health care system. There are better ideas, and a whole lot of them are bipartisan. There's bipartisan bills right now to lower the cost for patients when they go to the doctor by implementing something called site neutrality. There are bipartisan bills that will lower drug costs by bringing more generic drugs to market. But these ideas only help if there's a functioning healthcare system to build on. A functioning healthcare system, as challenged as it is, that includes Medicaid. As Americans, we don't shrink from challenges. We don't surrender to cynicism and lies. We work together. We do hard things. We do what it takes to build a better future for our country, and we do it in a way that brings all of us along together. And that includes ensuring that all of us have health care. That's the way we created Medicaid. That's the way we expanded Medicaid. And it's through that same spirit of hard work and optimism that we can overcome the healthcare challenges of today if we can summon the political will to do it, a will that has been so sorely lacking since this president arrived on the scene. The Senate should not pass a budget that rips health care away from millions of Americans, 60,000 of whom live in my state, just to give tax cuts to billionaires. But that is what this budget will do. It's un-American, and it is shameful. I yield the floor.
Madam President.
Senator from New Jersey.
Thank you, Madam President. I rise today to tell the stories of the nearly 2 million New Jerseyans who rely on Medicaid for their critical care. I do this because their care is at risk. I do this because the care of more than 72 million Americans across our country enrolled in Medicaid is at risk. They are at risk because Republicans in the House and the Senate have chosen to take away their care so that Elon Musk and the very richest Americans can pay a little less in taxes. That is the choice that they have thrust upon the American people. It's a choice that I don't believe they truly understand. So I'd like to take some of my time today on the floor to explain what happens when we choose Elon Musk's well-being over the people we've sworn to serve. To truly understand this, you need to understand that for tens of millions of Americans, Medicaid is their lifeline from the womb to their final years. In New Jersey, nearly 1 out of 3 births is covered by Medicaid. But even before that birth takes place, mothers receive prenatal care covered by Medicaid. That means for millions of parents across the country, the first images they see of their child in those early ultrasounds are because of Medicaid. It means that prenatal vitamins that provide the folic acid necessary to ensure proper development are because of Medicaid. It means that if there is a complication in pregnancy, that those parents can focus on their health and the health of their unborn child, not whether or not they'll be able to cover the costs of their care. That is because of Medicaid. So when Republicans are saying we need to cut Medicaid, remember that it's Elon Musk who wins and those expecting parents who lose. When those children are born into the world, tens of millions rely on Medicaid. Nationally, about 40% of children are enrolled in Medicaid or CHIP. In New Jersey, 1/3 of children, 1 in 3 kids in my state are enrolled in Medicaid. Now, as a father of a 7-year-old and a 9-year-old, I can tell you that the most important thing is knowing that your kids are healthy. There are a lot of things that are outside of your control as a parent. You can do everything right, but sometimes you just need help. Kids get sick. And having that assurance that they can get the care that they need is an important thing. When you take away Medicaid, you're not just taking away, you're taking away the peace of mind that parents deserve. You're taking away the ability for parents to look their kids in the eye and say, it's going to be okay. I wanted to share with you 2 stories that have stuck with me. I heard from Nicole, a mother from New Jersey who has a developmentally disabled son, Jordan. Jordan is 24. His mother said that Medicaid cut would be, quote, catastrophic. She said that the care she receives from Medicaid is vitally important. That sense of importance and urgency I heard from Nicole, I just saw echoed from Jamie from Hazlitt. Jamie's son, David, was born paralyzed, nonverbal, and he's relying on a feeding tube. Jamie told reporters that one of David's medications can cost up to $1,000 a month. She said that if Republicans are successful in cutting Medicaid, quote, we would have to choose, are we going to eat, pay the bills, or keep him alive? She said, quote, it's a life or death situation. So when Republicans are talking about cutting Medicaid to hand tax cuts to the wealthiest Americans, the choice they are making is to leave people like Nicole and Jordan, like Jamie and David, behind. At some point, our children grow up and leave. But even then, so many across this country rely on Medicaid for their basic care. In New Jersey, 1 in 7 adults between the ages of 19 and 64 are covered by Medicaid. So when we look at the choice ahead of us between care and tax cuts for the super rich, I want you to think about Caroline from Mount Holly. Caroline called my office asking that I oppose this budget plan. When she outlined her reason for not cutting Medicaid, she spoke in the clearest possible terms. She said, quote, I will die if there are cuts to Medicaid. Caroline is disabled. Her daughter takes care of her through the managed long-term services and support program. She ended her message by saying, please, I need help. A lot of us need your help. These are the people that need help, not Elon Musk, not the billionaires. It's like people like Caroline from Hackettstown. Caroline called my office because her brother is on Medicaid. He's scheduled to get heart surgery in the next couple of months, something that is scary enough when you got the uncertainty of health care. But Caroline doesn't have that if her brother's Medicaid is cut. She said, I'm really scared for him. I'm really scared for my parents who are about to retire. I'm scared for myself, someone who also has multiple health care issues and is trying to keep down a full-time job despite it all. These are the people that need help. Our neighbors who sometimes need the help most are those who are disabled. In New Jersey, 1 out of every 3 working-age adults with a disability is on Medicaid. Just last month, I invited Kevin Nunes, a disabled New Jerseyan, an advocate for his community, down to the Capitol. Kevin relies on Medicaid for his care, his caregiver, his basic quality of life. I brought him to the Capitol because I wanted Donald Trump to have to face someone whose health care he was threatening to take away. But it wasn't just Kevin there at the Capitol. We saw his caregiver, Edna, there. The work she does every day is truly incredible. We should support our caregivers, should honor their service, and cutting the funding that allows them to do their job is not the way to do that. Kevin is one of more than 15.5 million people across America with a disability who is covered by Medicaid. He's one of approximately 4.5 million people who use Medicaid for home care workers like Edna. The choice we are facing is abandoning those Americans like Kevin and Edna who just need basic care, or giving another tax cut to those at the very top. For me, that's not a choice. Finally, as we go through adulthood and age, Medicaid becomes more important than ever. Seniors across our nation are relying on Medicaid for the care that they need to live. 60% of nursing home residents in New Jersey use Medicaid to pay for care. When seniors are on a fixed income, like so many of them are, Medicaid can be the difference between life or death. Annie, a teacher in New Jersey, called my office recently. Her mother is on Medicaid, 71 years old, recently had hip surgery. She has no other income than her Social Security and asked that we do everything we can to make sure her Medicaid isn't cut. As someone who is not just a father of 2 young kids, but as a caretaker of an older parent, it weighs on me. And I understand the challenges that are there. Knowing that you have to do everything you can to make sure that the people you love have the care that they need. Life is hard enough. Care is hard enough. The point of Medicaid, the point of government is to make it a little easier, a little more bearable. So when Republicans come to the floor with a budget that threatens to cut Medicaid so they can give tax cuts and tax breaks to the ultra-rich, the choice they're putting before us is making your lives worse to make their lives better. It's making your health care worse to make their bank accounts bigger. It's making your future more uncertain to make their futures brighter. That can't be an acceptable choice. It's not one we have to make. We can reject this budget resolution and save Medicaid, save health care. We can reject this budget resolution and choose to support that expecting mother who just wants to give birth to a healthy child. We can reject this budget resolution and choose to support that child as they grow. We can reject this budget resolution and choose to support our neighbors who work hard but just need that little bit of help to stay healthy and achieve the American dream. And finally, we can reject this budget resolution and choose to support our seniors who we owe the best care to them in their golden years. This is a moment to show the 2 million New Jerseyans on Medicaid, the nearly 80 million Americans on Medicaid, and every other American across this country that we choose their well-being over the wealth and power of those who already have plenty. Let's reject this budget resolution and do the right thing for them. Thank you, and I yield back.
Senator from Kansas.
Good. Okay. Madam President, I have 6 requests for committees to meet during today's session of the Senate. They have the approval of the majority and minority leaders.
Duly noted.
Madam President, I ask unanimous consent that the appointment at the desk appear separately in the record as if made by the chair.
Without objection.
I ask unanimous consent that when the Senate completes its business today, it stands adjourned until 8 a.m. on Friday, April the 4th, that following the prayer and pledge, the morning hour be deemed expired, the journal proceedings be approved to date, the time for the 2 leaders be reserved for their use later in the day, morning business be closed, and the Senate resume consideration of Cal number 38, HCON Resolution 14, Further, that all time during adjournments and leaders' remarks count equally between proponents and opponents on the current resolution.
Without objection, so ordered.
If there is no further business to come before the Senate, I ask that it stand adjourned under the previous order following the remarks of my Democratic colleagues.
Without objection.
Madam President, I rise this evening once again to highlight Wisconsinites' stories who would be impacted by cuts to Medicaid that my Republican colleagues are proposing. Earlier this evening, I talked about children. Babies are most vulnerable. Now I'd like to talk about older adults. I rise to share the story of Renee. Renee is a 60-year-old woman. She lives in Milwaukee, Wisconsin. And in October of 2023, Renee was diagnosed with stage 4 breast cancer. It had metastasized to her brain, her lungs, and liver. She depended upon Medicaid for that diagnosis through a program that Congress created. And she also depends on Medicaid, or Badger Care as we call it in the state of Wisconsin, for her treatment. Without Medicaid, she said, and I'll quote her, "I would be forced to ration or forego cancer treatment, hastening my death, or send me and my husband into bankruptcy trying to keep me alive," end quote. In March last month, I brought Renee to President Trump's State of the Union address to show this president who his massive cuts to Medicaid will hurt. Medicaid provides health coverage to 7.2 million seniors nationwide. That's millions of Americans just like Renee, who rely on Medicaid for the life-saving treatment that they need. I also heard from Linda. Linda lives in Viroqua, Wisconsin, where her husband and she run a dairy farm that they bought nearly 22 years ago. Linda served her community for 30 years as a registered nurse, working primarily with new moms and babies before she was forced to retire due to chronic health issues. Since then, she and her husband have relied on Medicaid and he on Medicare for their health care because they cannot afford other types of insurance. Like so many dairy farms in the state of Wisconsin, Linda and her husband work on very tight margins, made even tighter by Trump's first-term tariffs, which, according to Linda, put us into poverty. This was in Trump's first term. Now they are staring down another Trump trade war and wonder how it's going to impact their dairy operation. She wrote, "I'm not proud that I have to use Medicaid and Medicare for insurance, but at 63 years of age, it appears that I will not be able to work at a job that provides health coverage or a living wage. If the cuts in Medicaid become a reality, not only will we be homeless, but we will not be able to access the health care and drug coverage we need to have a quality of life. We never thought we would need government health care, but here we are, and the outlook has darkened considerably for many dairy farmers since January. This fight to protect Medicaid for seniors is personal to me and thousands of Wisconsinites. My own mother relied on Medicaid at the end of her life to afford nursing home care, as do the majority of Wisconsinites in skilled nursing homes. 6 in 10 residents in our state's nursing homes use Medicaid, or over 10,000 seniors who might not be able to otherwise afford to have a safe roof over their heads. Medicaid also supports more than 43,000 elderly or disabled adults who receive long-term care at home in our community. That includes people like Tammy in Monona, Wisconsin, whose father, Bud, battled dementia at the end of his life. Medicaid allowed Tammy's dad to stay in his home for the last 5 years of his life with the support of at-home caregivers. She wrote to me, and I quote, "People should be able to choose where and how they spend their last days in life. And Medicaid allowed my dad to stay in his own home with familiar surroundings that helped ground him when his dementia was the most challenging for him. Please continue funding Medicaid to be able to help other frail elders stay in their own homes." There are so many pleas that I hear from my constituents in every corner of our state. And it's these constituents that I hope President Trump and congressional Republicans are listening to when they think about ripping away Medicaid to pay for their tax cuts for big corporations and billionaires. Seniors like Renee and Linda know that Medicaid is a lifeline for Americans who otherwise would have nowhere to turn. It's Wisconsinites who will face bankruptcy just to stay well, who will pay for Donald Trump's giveaway to the top 1%. I cannot believe that my Republican colleagues are even considering a plan that is so backward and so cruel for hardworking Wisconsinites and seniors. This is wrong, and we must continue to fight back and say loudly and clearly, hands off Medicaid. I yield.
Senator from Rhode Island.
Thank you, Mr. President. Well, we're back here again with another variation on the Trump plan and the Republican plan to do further damage to our economy and to the working men and women of this country. It's been sliced and diced and repackaged and unpackaged, but it still boils down to a very simple equation. Big tax cuts for the very, very wealthy and cuts to Medicaid and other key programs that are essential to Americans. This resolution is going to cost a lot of money, about $5.8 trillion with a T. Now, today, President Trump unveiled, or yesterday, I should say, unveiled his tariff policies, and today, the markets reacted. They lost $2.5 trillion in value. So he is just taking a sledgehammer to our economy and a sledgehammer to the working families who depend upon these programs like Medicaid, and a sledgehammer to our universities and medical schools and research laboratories, which have made us the premier center for research, innovation, and healthcare in the world. And with these sledgehammer blows, I don't think we can maintain that status. These proposals by the President and my Republican colleagues are designed to take away the health care coverage from millions of Americans, seniors, kids, veterans, individuals with disabilities. And they particularly seem to focus on Medicaid. Now, Medicaid provides essential health care services for the most vulnerable populations of the country. It covers nearly 80 million people if you combine those covered by the Children's Health Insurance Plan, CHIP. In my home state of Rhode Island, over 300,000 people, and that's about 1/3 of my state, depend on Medicaid. And The Republicans are talking about cutting this program by $880 billion, which would be devastating. And looking at the Medicaid recipients in Rhode Island, it's interesting. 1 in 5 adults aged 19 to 64 are covered. 1 in 3 children are covered. And we all know how critical it is for health care for children, because a childhood problem left untreated can lead often to much more serious health consequences as they grow older, much more dependency on social programs, which are paid for by us. Good health care as a child guarantees, in many, many, and most cases, success in school, success in life, and a healthy life. 1 in 3 children. Now, 5 in 8 people residing in nursing homes are receiving Medicaid. So let me tell you what's going to happen when Medicaid is cut by this extraordinary amount of money, $880 billion. A lot of nursing homes will close because their margin, the difference between opening the doors and closing them is the Medicaid money they receive. When that goes, where are you going to put your ailing mother or grandmother? I'll tell you what to do. You're going to do it like they did it before Medicaid. When I was a young kid, it was not unusual to go visit someone, and in the front room there'd be the hospital bed and the grandmother, and the mother was taking care of the person, and that was health care back then. But after Medicaid, we were able to create a much more effective health care system. And this will touch not just the very poor, this touches the working families. It's the only way they can keep really their mother or father or older relative or a child with a very serious illness in a safe, protective place where they can receive appropriate care. Now, 3 in 7 Medicaid recipients in Rhode Island are working-age adults with disability. Now, this is a situation where these people, because of their physical limitations, cannot work, need assistance. Some are severely disabled, others are significantly disabled. And they're going to be left literally out in the cold. And I must say there's a corollary here, because just a few days ago, the president announced that he was going to take the IDEA education program and move it into the Department of Health, which at the same time is trying to shed thousands and thousands of workers. So my fear, of course, is that, again, going back into my youth, the 50s and the 60s, that children with disabilities will be sitting in the back of the room by themselves, trying to keep themselves occupied, because what we have created through IDEA, a system of education tailored to the individual child's disability, will be unsupportable. And that's the kind of damage he's doing. And it's the working people, it's the families, it's the kids, and it's, I think, inexcusable. Throughout the country, 38 million children rely on Medicaid. 2.3 million children with disabilities, as I said, throughout the country rely on Medicaid. And also, as I said, throughout the country, not just Rhode Island, 7 million seniors count on Medicaid to afford nursing home care. So we're in a situation now where we are basically undercutting our health care system. And it's not just these people who feel it, everyone will feel it. If these Medicaid cuts go through, it will create so much turmoil in my state that our health care delivery system will be under great pressure, but I think so much pressure that it will not work. Where do people go when they don't have health care? They go to the emergency room. So if you or me or somebody we might even have health care insurance, and then we have a serious problem, well, we can go to the emergency room and just get in the back of the line that's going all the way around the block and through the parking lot and every place else, because these hundreds of thousands of people without health care, that's where they'll have to go when they're so painful they can't go to work. This is a disaster in the making. And again, we saw last week and weeks before President Trump talking about, I'm going to put tariffs in and we're going to fix the whole economy. Nonsense. It's a disaster. It's killing our markets. And once again, I'm going to go in there and take out Medicaid, et cetera, et cetera. It'll be a disaster. And I think we must avoid it. We are better off because of Medicaid. Better health care outcomes in this country. A different country, literally, than it was prior to the introduction of Medicaid, and a better country. It provides health care coverage for example, 17 million women of reproductive age, so they can have the health care they need. And it helps families grow and prosper. And by making seniors and people with disabilities get the care they need, we are, I think, living up to the aspirations of this country, which is to ensure that those who need care get care. You know, there's been a lot of men and women who've served in the armed forces of the United States, and I was proud to do it myself, and they weren't risking their lives so that a very wealthy individual could have 5 Mercedes rather than 4. They were risking it so kids could have health care who needed it, so their mother and father could have a place to be when they were sick and ill in their older years. And what we're doing, we're forgetting that sacrifice, and we're saying, no, we're just here to pay off the rich people who paid off so much through the president's campaign to get him elected. Now, one thing I want to emphasize, which is very important and often overlooked, going back to Rhode Island, 74% of adults in Rhode Island and Medicaid are working. There is this insidious notion that this is just a free giveaway to people who don't work, who don't deserve it, etc. That's why we can get rid of it. 74% of the people on Medicaid are working, and they're working very hard. Oh, and by the way, my guess is they're not going to get a big benefit from these tax cuts because they're minimum wage or a little bit more. So we are really doing something that is so unjust and I believe un-American, of rewarding the wealthy, some of whom have worked hard to get it, some of whom just were lucky enough to be born to the right parents, and we're giving them a fortune, and we're taking away basic health care from working men and women. So we are in a very, very difficult situation. I don't think we can touch Medicaid. And for the moral reasons I tried to suggest, and for the economic reasons. If those 74% of Medicaid adults who are working can't get to work because they're ill, how do we get the jobs done? We don't. And the impact on the nation in terms of these cuts are going to be horrendous. And this impact is going to be every place in the country. I talked a lot about Rhode Island, but one of the ideas the Republicans are advancing to cut Medicaid is to eliminate the Medicaid expansion provided for under the Affordable Care Act. Now, according to the Urban Institute, and the Robert Wood Johnson Foundation, this cut would cost 41 states over $44 billion. States would have to increase their share of Medicaid spending by 25%. States like North Dakota, Indiana, Montana, and Nebraska would see their costs go up by 30%. So I hope my colleagues from these states are ready, willing, and able to go out and tell their constituents, your health care costs are going up 30%. Now, obviously, I oppose this resolution that is being proposed. We have to do more, not less. And it's not just about the moral commitment I feel we have to people who need health care coverage. It's about the economics of caring for people early before it becomes more expensive, providing facilities for people who need those facilities rather than let them languish at home. And Mr. President, with that, I would yield the floor.
Madam President.
Senator from Nevada.
Madam President, Madam President, excuse me, Mr. President.
It's happened to me before, too. It's okay.
I apologize.
No
Mr.
worries.
President, I am joining my colleagues today because Nevada's health care and Americans' health care, it really is not up for negotiation. And on Wednesday, I want to recognize this. Senate Republicans released their budget plan to pay for President Trump's billionaire tax cuts. You've heard everybody talking about that. We've been on the floor. This is so important for the American public to understand what's at stake, because really we can't let them fool you with some bureaucratic language or to make them seem less devastating than these impacts really are, or to use some sort of math gimmick. Because here are the facts, and let me just say, April 3rd, 2025, we just received from the Joint Committee on Taxation that shows that President Trump and his Republican followers in the Senate really want to add almost $7 trillion to our national debt. The Republican plan to extend the 27 Trump tax law will cost $5.5 trillion, including interest, and the budget resolution Senate Republicans introduced this week allocates an additional $1.5 trillion for tax breaks to be crafted by the Finance Committee Republicans and the Trump administration. This brings the total cost for over 10 years of the Republican tax plan to about $7 trillion. $7 trillion in deficit and debt. And they are doing this to give tax cuts to billionaires. And in order to pay for it, one of the things, and you're hearing us talk about this, is they want to slash Medicaid in this country by almost $1 trillion. You've heard this term, $880 billion, because that's what the House has sent to their committee to say we need to find some way to pay for these $7 trillion that in tax cuts that we want to give to billionaires. Now, Nevadans and so many across the country are being told these cuts are going to come from cracking down on waste, fraud, and abuse in Medicaid. Well, that would be great if it were true. Let me just put a fine print on this. I'm all for getting rid of waste, fraud, and abuse within government programs. And I know that many states, and actually all states, including the Attorney General's office in the state of Nevada, they actually have a Medicaid fraud unit that goes after that fraud, waste that we see across the country. Every state has one. But here's the simple truth. We are not going to find $880 billion in pay-fors by only cutting waste, fraud, and abuse in Medicaid. To shrink this essential program down by nearly $1 trillion, President Trump and his Republican allies in Congress, they actually have to gut Medicaid. There's no other way around it. That's what they have to do, and that's not just a talking point from the Democrats. The nonpartisan Congressional Budget Office, their analysis confirmed that Republicans would have to make the largest cuts in Medicaid history to meet their budget's $880 billion target. Now, here's what I know, and you're hearing from all of our colleagues that tonight, and you will hear this as we go into the votes that the Republicans want to take on this. I don't care whether you're from a red state, blue state, you live in an urban area, rural area. Medicaid cuts to pay for billionaire tax cuts would hit everyone hard. It would be devastating. And nearly 800,000 people in Nevada would be devastated by this because they depend on Medicaid to keep themselves and their families healthy. This includes 1 in 6 adults, 3 in 8 children, 4 in 7 nursing home residents, and 1/3 of people with disability. I also know that 66% of adults in Nevada who benefit from Medicaid, they work for a living. And 43% of our births are covered by Medicaid. In Nevada, 17,600 Medicaid enrollees used home and community-based services and long-term services to support them. These are seniors, these are people with disabilities. And nearly 40% of all children in Nevada are covered by Medicaid and CHIP. And you heard my colleague from Rhode Island say this, and I also want to dispel this notion that people on Medicaid are somehow lazy and they don't want to work and they're just somehow milking the system. Let me be very clear, nearly half of all Nevada Medicaid enrollees, that's 380,000 people, are people with jobs and their dependents. Now, I want to put a fine point on this because I have to just call this out. This is just a crazy notion because I've met these families. I've met a woman, she and her husband are working, they're both working full time. Their daughter has a rare disease. Without Medicaid, they would not be able to afford the medication and the healthcare, access to healthcare that she needs. I have visited in my state clinics, FQHCs, clinics, federally qualified healthcare centers in the north and the south. I was in the northern Nevada one just 3 weeks ago. And I was looking at the individuals that were coming in for care, and I asked them, how would you be impacted by Medicaid? Not only would it devastate this health center, I said, who are these people that are coming to you? You know who they are? They're people that are working at Amazon. They're people that are working at Amazon and Walmart that have to get Medicaid because the billionaire owners of these organizations don't care enough to provide them health care. This is outrageous, but these are the people that we are talking about. And let me just say, last month I met with a group of obstetricians from northern Nevada. Medicaid is the largest payer for maternity services in my state. In 2023, there were 13,206 babies and their mothers who had access to essential health care. Nevada Medicaid does postpartum coverage up to 12 months thanks to the American Rescue Plan. And now the Republicans and Donald Trump want to take it all away. I know I am not the only state that is dealing with this, and I will tell you, and it's some of my colleagues I know, and I've talked to them, whether you're Republican or Democrat, we have talked about this. It's devastating for our urban areas. It would devastate my rural communities and every rural community across this country. If you live in a rural community in my state, you have very little access to health care. So you want to keep those clinics open. Because if you don't, then you're driving 4 hours just to get your health care somewhere, if you have the ability to get there and drive there. And so I know it's not unique, and my hope is that my colleagues and my Republican colleagues who care like I do, and I know they do, about their constituents, we are going to address this issue and we're going to work together so we can protect Medicaid. But, Mr. President, I would like the opportunity to engage in a colloquy with one of my colleagues who is here today from Michigan.
Without objection.
Thank you. Because Senator from Michigan, Senator Slotkin, I know, like my state, they call it a swing state. It's a swing state. We have voters that we represent that are Republicans, Democrats, Independents, and it really isn't about your party. It is about health care and access to health care in this country. And so for my colleague from Michigan, I am curious what she is seeing and the impact that the Medicaid cuts that we are talking about would have to your constituents, the people that you represent in Michigan.
Thank you, Senator, and thank you, Mr. President. I mean, I think what we're all here talking about into the dead of night is this idea of who we want to be as a nation when it comes to providing health care. Do we believe that the greatest country in the world should be able to treat the people who need help in our country, or are we okay with the poorest among us, the weakest among us, those who are disabled, those who are elderly, those who are children, just not having access to care? And as you said, when you look around at the math, right? This isn't a political statement. The math of needing to find $880 billion with a B, the math just doesn't work without gutting Medicaid. And I think it's important to understand, at least in my state, that this isn't just about people who have Medicaid as their primary insurance, right? We have 10 million people in Michigan, 2.6 million people are on Medicaid. The vast majority are children, right? People who can't live up to work requirements, people who just happen to be, young people who happen to be born where they were born. 37% of all our births in Michigan are handled and covered by Medicaid, and 2 out of every 3 nursing home elderly are covered by Medicaid. So it's not just about the people who are receiving direct care, it's about what Medicaid reimburses and funds. The idea that 65% of our nursing homes could potentially go under if they don't get this funding. The idea that our rural hospitals from Hillsdale to Marquette, Michigan, have come to see me and they say, look, we're not Democrats, we are conservative people, but if you take away this reimbursement, we will collapse. They're already suffering after COVID, they're barely hanging on. So access to rural hospitals is something we're deeply, deeply worried about. I think the bigger question is, who do we believe we are, and do we have a commitment to serve and protect and provide basic health care to people in our states? Now, you mentioned this, but I think it's important to realize that with a number that big, we're not just talking about Medicaid. There's real risk of Medicare Part D being touched, the prescription drug piece of that, and the Affordable Care Act, which so many people depend on, the many, many people being cut off from that at the end of the year. The math just doesn't work. And so what we're really talking about is, in the state of Michigan, in the United States, the potential for either people to lose their coverage or to have the price of their coverage go up. Because everyone talking about these Medicaid cuts back home has also mentioned that, by the way, if we don't get the Medicaid reimbursement at our hospital, I'm just going to charge more to the people who have insurance. There's going to be more people in my ER. I'm going to have to pass that expensive price off to customers who do have health insurance. So it's just important to understand the full spectrum of what we're talking about here. Now, I'm sure you've heard a ton of personal stories, right? It's important to understand we're giving a talk on the Senate floor, we're talking about numbers, but at the end of the day, this is human beings. And I'm sure your phones are flooded, as mine are, with people who want to tell their personal stories. And I will say, for me, it feels like Groundhog's Day, because I decided to run in 2018 for the very issue of health care, because I happened to live through my mother getting stage 4 ovarian cancer without having insurance. She had no insurance. And that first month of that terminal diagnosis, where you're desperate to get her tests and coverage and some kind of emergency surgery, you're using your credit cards, you're doing whatever you can, while you're just feeling completely lost, that you know your mother is going to die. That feeling is the worst feeling I've ever experienced, and it's what we're proposing to millions of additional Americans by the end of this year. So I'm sure you've heard a lot of personal stories on your phones. I don't know if you want to walk through a couple of those stories, but I think it's important to make it a human issue, not just a numbers issue.
And that's right. And I thank my colleague from Michigan, because it's true. I mean, I can tell you, in February, I spoke with Madison from Nevada. She has stiff person syndrome. This is a disease that impacts all her muscles and her breathing, and she has to be on a ventilator 7 times. She wouldn't be here today without Medicaid, which provides her with home health care. And Madison's sister, Tricia, was with her that day when she had to deal with such, and this is trauma. This is such, healthcare is trauma in somebody's life. If Madison's Medicaid coverage ends, she would have to go live with her sister and depend on her for care. She'd be forced to move away from her community and her whole life. Madison needs really Medicaid to live her life to the fullest. And like my colleague says from Michigan, these are real people that will be impacted. And I know she's seeing the same. I do want to pose to her this thought, though, of it's not just the individuals. We know there's real life impact, and we see it. We hear it in our offices. We are getting those calls. We're meeting with individuals. We know them. We know them. They're our neighbors or our friends. We know them when we're home. Here's the other thing people forget, though. I know in Nevada, we already don't have enough providers in Medicaid. We don't have enough providers in the program to begin with. And expanding the number of healthcare providers in Nevada, it really has been a priority of mine, and that's why I am leading legislation, bipartisan legislation, with my colleague, Senator Cassidy from Louisiana, to support graduate medical education programs. But here's the deal. If Medicaid funding in Nevada is cut, not only will those rural health clinics close that I talked about, but here's the thing people forget. We would have fewer providers because they would be incentivized they would not be incentivized to come to my state and treat patients. They're going to figure out where they can go and still survive. Remember, our providers have to still survive and make a living, and they want to treat patients. And so we are going to have a provider issue in my state. And I don't know if that is an issue for Michigan, but it is something that goes hand in hand with these Medicaid cuts, because I hear from my providers as well.
Yeah, I mean, I think we talked about rural hospitals. I think, again, even if you're not on Medicaid, you've never signed up, you've never been at a low point in your life where you've needed a bridge, you've never had a child with a disability, you've just never touched the system, I guarantee you the hospitals that you depend on, the clinics that you depend on, the nursing homes that you depend on for your mom, your dad, are dependent on Medicaid. I guarantee it. And what we're hearing from our rural hospitals is, look, we're the only hospital in 3 hours where you can get care. If we go, where do our people go? Where do we tell them to go? If you're delivering a baby and you have to come off the Upper Peninsula into the Lower Peninsula of Michigan, there is just no way that we can function that way. So it's not just about, as you say, individuals, although those stories are striking. It is about access to care for everybody. I was talking to a doctor from the Lansing Carefree Medical Clinic. It's completely Medicaid covered. It is the folks who are left out of the system, he will just close. I mean, we'll have clinics just close. So I think we're talking about something that, again, comes to the heart of like who we are as a community. I will also just say, I think it's important to put a warning label on it, and then I'll turn it to you to maybe finish out, is there's a lot of magic math going on right now on the other side of the aisle, right? How do you take a group of people who both want to cut Medicaid in a devastating way, want to cut other health care in a devastating way, and match them up with a bunch of people who say, I can't, colleagues on the other side of the aisle who said, I can't accept cuts like that? How do you balance two completely different factions in the same party? And it happens, right? What normally we would see is tough choices being made. right? Either the other side of the aisle is going to acknowledge we have to make these devastating cuts, or they're not going to cut them. But what we see now is the third secret option, which is magic math, which is we're going to tell you we're not cutting anything, but we're going to quietly make the math just work so that we are actually cutting all these things. We are able to reap the benefits, or we push those cuts out to the out years, right? So you don't notice them today, but maybe later, maybe after other elections, you're going to feel those Medicaid cuts. So it's just my big warning label on the whole story here is that there's magic math going on from beginning to end on this package, and don't be fooled. They are coming for your health care. You are either going to be paying more or you're going to lose your coverage. That's just a fact based on the math that they've put out publicly and voted on today. So I thank my colleague for the opportunity to do my first colloquy. I didn't know this was a thing that we could do. Thank you for giving me that opportunity, and I'll let you finish us out.
Thank you, from great senator from Michigan. Let me say I'm so pleased that she brought this up because it is a gimmick. The gimmick that they're playing right now is somehow that these $7 trillion in tax cuts that they want to give to billionaires is not going to add to our deficit or debt. Remember, these are the Republicans, the party of fiscal responsibility. And it's not going to add to our deficit or debt. This is a perfect example. I read this in the papers. Perfect example of what this means. This is like you're a parent and you have put your daughter through college for 4 years. And she comes home and she says, oh, well, it's not going to, you're already paying for it, so it's not really an additional cost to you. So I'm just going to stay home and not work, and you just continue to pay the same amount that you were paying for college, and I'll just live off of that. It was a great example one of our papers put out, as a journalist put out, because that is exactly what the Republicans are trying to do here. This is it. And remember, they are next going to come and try to lift the debt ceiling, more debt to pay for this. This is the party of fiscal responsibility. At a time, think about this, at a time when our economy is already in a free fall because of these crazy tariffs. And by the way, if you care about your retirement and your 401k, you're watching that stock market because that's in free fall. That's what this administration, that's what these Republicans are bringing you. But remember, when they started, they got handed an economy from the previous administration that was going strong, that had just come out of a pandemic, was trying to turn everything around. Was it perfect? No. But we were working on addressing the challenges facing this country. I know my colleague from Michigan knows this. Our families' prices are too high. Costs are high. We got to focus on them. We got to lower those costs. These tax cuts should be about them. More money in their pocket. We started doing that around health care, capping the cost of insulin, making sure that those big pharma companies, they would negotiate with us and we can keep those prescription drugs down. We started that process. We have more to do. I know that. But when President Trump came into office, the first thing he said, he was going to lower those costs for our families. That is not his priority, and that's not what he's doing. And that's why we have to shine a light on this. And that's why I'm so proud of my colleagues for standing up and making sure the American public knows that they're coming after your health care, and they're coming after your retirement, and they're coming after you so that they can pay for these tax cuts for billionaires. With that, Mr. President, I yield the floor.